Okay, so thank you guys for joining me today. For those of you who don't know me, I'm sure most of you do since I recognize so many people coming on the call or on the webinar, I should say. My name is Melissa Tompkins. I am a certified veterinary practice manager. I am a professional in human resources for the state of California. I'm also a certified compassion fatigue professional. I own my own veterinary management consulting company, South Coast Veterinary Management Solutions, and it is that freer time that allows me to be able to give you these webinars and spend so much time researching Cal OSHA fun for everyone. So I'm thankful I'm in this job now. So if I was in practice full time like I used to be, I would not have the time to do this. So thank you guys. So thank you for joining me for round number 3 for our lovely emergency temporary standards. So I'm gonna go ahead and get started. All right, so there you go. Okay, so I do have a legal disclaimer for you. And I do this because I'm not an attorney and I don't want anyone to hold me legally accountable for anything you guys decide to change because of today's presentation. So my legal disclaimer that I will read to you, by watching my webinar, my video, you are basically saying, yes, you agree to this term. You don't have to sign anything or initial or anything like that. So my legal disclaimer is the information that's presented in this webinar is gathered from a variety of sources, all of which I have cited. Please refer to these sources when making changes and decisions for your practice. My intent with this webinar is to inform you of the changes and the resources available to you at this time to the best of my ability. Any opinions shared within this presentation are mine and are not to be construed as legal advice. I'm not a lawyer, and if you have legal questions, please seek the advice of an attorney. So that is my legal disclaimer. Okay, so today's presentation was going to be sponsored by Dog Days Consulting. Unfortunately, Linda, who was going to be the person who was my moderator for today, is in thunderstorms because she's in Oklahoma. So my wonderful sister Courtney is actually our moderator for today, and she's the owner of Simply Radiant Events. She owns an event planning company located in Orange County. She does corporate events, private events, parties, weddings, from really big to really small. She does everything. So I did put her website on here for you guys to check out if you're looking for any of that kind of help. So Courtney, why don't you just take a quick wave to everybody so they know who you are. She's the one that was admitting you to the meeting today. She's also going to be answering questions in the chat that you put out there if she knows the answers, and she'll be kind of guiding you through any of those things. So this meeting is being recorded, as you all know, and I will put up the link and send out the slides probably within about 24 to 48 hours. I send the recording to get closed caption on it through rev.com. If you're ever looking to do any type of closed captioning or transcribing, rev.com is amazing. They're great to work with and they're super fast. So as soon as I get that back, I'll be able to send everything out to everyone that registered. So, and I'll put this on my YouTube channel as well. Okay, so this is the revised ETS for the 3rd time. The first one was November of 2020. The second one was June of 2021. And the last one was January of this year. And now we're doing our 3rd round of that. And unfortunately, for whatever reason, Cal OSHA has not updated anything on their website as of about 5:30 this morning when I checked it last. But they did put out like the legal disclaimer. So I did put a link to that, the COVID Prevention Emergency 3rd Readoption Plan. It's all in lawyer language. I could not read it. Thankfully, Fisher Phillips decided to do a summary of the changes, and they also did a webinar last week that I attended. So I put links to both of these things on here. So when you get the slides, you can review it if you're interested. The ETS is effective on Friday, the changes, I should say, and it is going to be effective through the end of the year. Does that mean that it's not going to continue or be changed into 2023? That does not mean that. I feel like there's probably a good chance we'll have another one, but maybe not. I don't know. We'll be optimistic. So again, effective Friday through the end of the year. So one of the things I want to throw out there first is whose guidance do you follow? Because I feel like this is something that we do kind of have struggles with because there are so many different things coming at us all the time. Who do I listen to? Who do I pay attention to? And realistically, it's the strictest one that affects your area in a sense. So San Francisco County, Alameda County, Solano County, Sacramento County, and LA County all tend to have different rules than the norm. So California Department of Public Health will come out with a ruling, and these counties tend to say, no, I want to do something different. So if you're in any of these counties, you really need to be looking at your county health order before assuming that the things you see on the news and the things that you see from CDPH are correct. And hopefully, once we get the ETS updated to Cal OSHA's website, they're going to defer a lot to the CDPH, because the CDPH changed things, or they change things more frequently, and they update their website more frequently, and Cal OSHA does not. So hopefully Cal OSHA will start to do it where they just click it. So when you click on it, it links you to California Department of Public Health, so that you're not stuck in the confusion of what does OSHA say, since Cal OSHA hasn't changed anything, even though technically they might have behind the scenes. So, but as far as the rules, you got to follow whoever's stricter for you. If you're in one of the stricter places, even your local city ordinances, if you have anything that's more local to you, you need to be checking that as well. All right, so there's a lot of new definitions that I think some of it too, when I was reading it, I'm like, people probably assume this was already a rule, but it's not technically a rule until Friday. But the definition of COVID test has changed. COVID test used to be, you had to get a laboratory approved test. That was a rule a while back. And Cal OSHA hasn't updated all of their things to say exactly which test is approved. And so they're basically defining that COVID-19 test has been amended, that it's okay to meet the return to work criteria, that you can do a self-administered test. Your employee can take it at home, they can take a picture of it and send it to you, and that is sufficient. I'm sure most of you have already been doing this for the past couple of months, but now it's legally okay. Or I should say it's now Cal OSHA approved that you can do that, even though we've probably been doing it for a while now. So if you're not already doing that, you can, and I recommend that you do have them send you a picture of it. If they're not, obviously most of the time they're not by you. So you have a copy of it, proof of what their positive was, and proof that they're negative if they're retesting. Okay, so another new definition of face coverings. So the definition of face coverings has been amended to delete the requirement that says light can't pass through it. Because one of the things they realize is a lot of the N95 masks, although were perfectly appropriate, you could still see light through the little like holes that it had, those little holes around your nose area. So they did amend it where they took away that requirement that said light can't pass through it. So that is no longer an issue. So that N95 masks, all N95 masks will be sufficient. And hang on, I'm gonna go back because I feel like I slipped a slide. Oh well. Okay, so the other thing, and I'll talk about masks in addition a little bit down. I have a couple slides down the road. I'll talk more about the masks. So when I'm saying the mask definition changes, I'm not saying that you have to make your employees wear masks all the time. So I'm just to kind of give you my caveat to that. So what's another definition that has changed? Fully vaccinated. That term has been deleted. So it's largely, now they said it's largely in response to the fact that the face coverings provided by the emergency temporary standards no longer make the distinction between fully vaccinated and unvaccinated. I kind of think it might be too, and this is my personal opinion, this is not anywhere in writing, it's just me thinking out loud. I think a lot of it too is that they have all these boosters coming. I know I got an email from LA County Public Health that the 4th booster is available for certain age groups in my county. I'm in Long Beach, so I am regulated by both LA County and Long Beach Public Health. And I think that it's going to be a lot harder to track if they're getting all these boosters. So I personally think that might have something to do with it, but that's just me. I would keep something in mind though, because you're not going to be required to track the vaccine status of your employees like you were previously to determine whether they can wear a mask or not. I do think if you're still doing it, it's not a bad idea, because even though there are rules today, that doesn't mean that they're going to be the same exact rules a month from now or 2 months from now. And if you have to go back and gather the data again, it might be a pain in the butt. So if you already have a system for it and you're already tracking it, I would continue just so you have the information. But if you don't want to do it, you don't have to. Okay, so another new definition, and this one's just kind of funny. So they changed the definition for someone who had COVID-19 symptoms within the past 90 days, and they basically gave it a name. So they're saying returned case is defined to mean that COVID-19 case, someone who tested positive for COVID, who returned to work and did not develop any symptoms after returning, they can only be considered a returned case for 90 days after the initial onset of symptoms or the first positive test. So basically, you don't have to explain, oh, if you have COVID symptoms within 90 days, you can just say you're a returns case. So I don't know if it's an important definition, but in case you see it, then you'll know what we're talking about. Okay, so those are some of the definitions that were put out and some of the changes that I learned from Fisher Phillips. So Fisher Phillips did put a great webinar together, and they did their great 10 things that you need to be aware of. And giving them all the credit for it. I didn't make any of this stuff up. I copied and pasted, so they get every bit of the credit. So a couple of things that you need to be aware of is testing symptomatic employees. So under the current ETS, which is the one that expires tomorrow, you need to make a testing available only to your unvaccinated employees or not fully vaccinated. Well, now that that term has been basically deleted, the testing is for anyone. So if you have a workplace exposure, you have to offer testing to anyone who may have been exposed to that person, versus before you only had to make testing for someone who was unvaccinated or if they were having symptoms or something like that. And then again, this is relating to workplace exposure. So this could increase testing costs if you have to test everybody. Where if you don't already have a stock of tests, I would recommend that you get that, so at least you have some around. I'm going to talk a little bit about outbreaks, and there has been an increase. So it will be something that you need to be potentially thinking about. Okay. And one thing I didn't say too, if you guys have any questions that you're thinking about, you can type it in the chat. I'm going to pause a little bit down the road so that Courtney can read me the questions and then I can answer them for you. So if you do have anything, you can go ahead and type it in the chat now. I'm not going to see it yet, but I will eventually. So hopefully I can eventually answer your question. And then hopefully I'll answer it by the time we get to the end of the presentation as well. So one of the big changes per Fisher-Phillips is that you can have employees self-attesting to their symptoms. You don't have to do it for them. You don't have to take their temperature. You can tell them, okay, every morning, I need you to confirm that you have no symptoms or you have no known exposure or whatever you want. You can have them answer like some questions for you, or you can just give everybody the rule book and tell them that, they're going to come into work knowing that they've complied by those rules. The Fisher-Phillips, they still get emails every day that they have to answer the questions for, however you want to do it. If you haven't been doing it, I'd recommend you kind of come up with a system to at least show Cal OSHA if they're having any, if they asked you questions, you can at least show them that you're doing something. But if not, I don't know, it's up to you on that one, but you don't have to, you're not required to take their temperature any longer. So if you haven't been doing it, then you're good. So I know a lot of people haven't been doing that. So, okay. So now we're going to talk about face coverings. So obviously the state lifted the face covering mandate in general. There's still some specific situations where it's required, and we'll talk a little bit about that. But the general face covering mandate was lifted, I think, February 21st, 22nd, something like that, the end of, I don't know, sometime in February. And it's no longer mandatory for unvaccinated workers. So what they kind of did, because Cal OSHA didn't change that in their language, Governor Newsom had come up with an executive order saying it's not required to kind of strike down the emergency temporary standard that Cal OSHA did. Well, now the new ETS that's coming out Friday will just confirm that, yes, it's not required. So it's not changing anything. It's still not going to be required as a general term for, or as a general reason for unvaccinated workers, with the exceptions of LA County, you still have to wear it on public transit. I think in San Francisco and other areas, you also have to wear it for public transit. And there's certain schooling things. And if you're in certain areas, if you're in the prison, there's stuff like that. But as far as us veterinary hospitals, there is no specific mandate saying that you have to do masks, with the exceptions of outbreaks and exposures, and anybody who still wants to wear a mask can. So, and I'll go over outbreaks in a little bit as well, because there was some changes with that. So now one thing, and I think you probably know about this because LA County made this change back in December, going into January, that you had to offer N95 masks, respirators as they call them. I think it's easier to say N95 because respirators to me are this giant like goggle things you put on your face, and that's not what it is technically. So N95 masks need to be available to your team if they ask for it, or if it's necessary due to an outbreak status. The current ETS said you only had to provide it to your unvaccinated employees, but now you have to give it to anybody who asks for it, or when it's required under those outbreak situations. So don't get rid of your mask stock. If you have one, just keep it. And if you need more, I'd maybe get some more just so you have it on hand. It's not like they expire. So I would definitely hang on to that, because you will be required to give it to them if they ask you, and or if you have an outbreak. Okay, so one thing that I kind of was not 100% clear on when Fisher-Phillips talked about it, but the cleaning and disinfection rules were eliminated, and the specifics that you had to clean your frequently touched surfaces, so your high touch, like your doorknobs, your keyboards, your phones, light switches, all the stuff that you were touching frequently. It's no longer required that you clean them at the frequency that you may have been originally from the original ETS when it talked about that. But it says you're not like you can't just stop cleaning altogether, because if you have an outbreak, or when you send out information for what you would do and like to protect your employees, you still have to identify what you're doing to clean it. So it's kind of a weird thing. They just say you don't have to do it at that frequency, but they still recommend you're doing some cleaning. As veterinary hospitals, I guarantee you we're all still cleaning, because that's what we have to do anyway, just because things are gross where we are. So I feel like everyone probably has a system for that. But if you were doing the high touch areas like once an hour, you don't have to do that anymore on a normal circumstance. But if you do have a COVID positive exposure in your hospital, you might have to clean it a little more frequently for that period of time that you're affected by that. If you have a client that came in a room and then they tell you later they had COVID, yeah, you're going to want to clean that room pretty well. But you don't have to do it to the frequency that you were doing, thankfully. Okay, so one of the things that they kind of streamlined, some of these definitions and these rules are more just clarifications and not big changes, which is good because there wasn't any crazy big changes with this new ETS. So I was happy with that. But they did kind of streamline that, the exclusion and return to work criteria, because it said something on ETS and then something on the CDPH, and it was just very confusing. And they've eliminated the specific language regarding close contacts on the ETS. And now it says, okay, you can just like look at what CDPH says. So California Department of Public Health says you can follow this rule in the new ETS. That's what you're going to follow, because California Department of Public Health is much more frequent with their updates and their communication than Cal OSHA is. So Cal OSHA is just going to make it easier. And Fisher Phillips, the law firm that did the webinar I watched the other day, predicted that there'll be a lot of links like that you'll go to Cal OSHA's website, you'll click on it, and it's going to take you to CDPH because they're just faster at changing and getting out the information. So just kind of being aware of that. It'll make it a lot more streamlined and stuff, especially for certain things. And then the deletes the specific return to work criteria for close contacts, because the CDPH has eliminated the requirement to quarantine just because you were in contact with someone who has COVID. And I will go over that in just a moment. Okay. So are there any questions so far, Courtney? I can pause here if there's anything that people have asked so far, because I can't see the chat from where I am.
No, nothing so far.
Okay, perfect. So this is copied and pasted again from Fisher Phillips's 10 things that you need to think about. And it said that CDPH released isolation and quarantine guidance, which has been, almost a month. So a lot of you are probably aware of it. But it states that individuals who are asymptomatic close contacts do not need to quarantine as long as they test within 3 to 5 days after their last exposure. At this time, Cal OSHA did not incorporate it, but they expect them to do that as part of this. So hopefully, again, that's part of that streamlining process. But like I said a little bit ago, you also need to always be checking your local public health orders, because San Francisco County, you have to know vaccine status to not quarantine, and it matters there, and it matters in other places as well. So anytime you're looking at changing something, that county health order is going to be the most important thing for you to look at, not just the CDPH and not just Cal OSHA, because that your local ordinance will matter more. I shouldn't say more, but that's the one you're going to look at. Okay, so this is a table from the CDPH, but it is really hard to read, so I have it on another slide as well. So this is for people, when it says COVID-19 cases, I'll clarify too, that means someone who has tested positive for COVID. It sounds weird when it just says COVID-19 cases, but that's how they wrote it. So just letting you know, that means that this person tested positive for COVID. So a COVID-19 case, regardless of vaccination status or previous infection, who do not develop symptoms or whose symptoms are resolving, shall not return to work until 1, at least 5 days have passed, 2, at least 24 hours have passed without a fever, and 3, a negative test is obtained on the 5th day or later. And then they can't come back until 10 days if the employee is unable to test or chooses not to test, or on their day 5, they test positive still, obviously. There is no more social distancing requirements when they come back. So that's kind of a change here, because social distancing was a thing that you had to make sure if they were tested and they come back, you can't be close to people. That is no longer a requirement for someone who's coming back, returning to work after having COVID. Okay, so this is, again, someone who has COVID-19, regardless of vaccination status of the previous infection, whose symptoms are not resolving. So the first slide was for people whose symptoms are resolving, and this is for people whose symptoms are not resolving, they cannot return to work until at least 24 hours have passed without a fever and symptoms are resolving, or 10 days have passed since some symptoms began. So that's something that it's kind of a change on that. Okay, so persons, again, same, it's just kind of like a little table into 3 slides. Regardless of vaccine status, previous infection, or lack of symptoms, a COVID-19 positive case shall wear a face covering in the workplace until 10 days have passed since symptoms began or the date of their first positive test. So if they're able to come back because they tested negative on day 5, they have to wear their mask until day 11, basically, because 10 days have passed since their symptoms began. So that's something that's a little bit different, because before everybody had to wear a mask and then they lifted the masks. And so it's kind of like, if you have someone that tests positive, they go out, their symptoms are really mild, or they got better, they test negative, they come back to work, they still need to wear a mask until day 11, basically. So I just want to clarify that with you. But they do not have to social distance when they come back. And I'm not sure why, but that's just the rule that was changed. Okay, so this is table 2, which is in regard to close contacts. And I'll go ahead and go to another slide because these tables are so small and hard to read. If you're on your phone too, you're like, what is that? So this is for when you have close contact. So this means you're exposed to someone who has tested positive for COVID, but you do not have COVID at this moment. At this moment, you just know that you were next to somebody who has it and you spent time with them or whatever. So the ETS is going to change to go with whatever CDPH says, which is good. So everyone, regardless of vaccine status, does not have to quarantine just because they were exposed to someone with COVID. They do need to test within 3 to 5 days after the last exposure, and they do need to wear a well-fitting mask around others for 10 days. So they can work, but they have to wear their mask while they're at work, and they have to test. If their test is positive, then they have to follow the isolation requirements, as I mentioned earlier. If their test is negative, then they can still be working like normal and then just wearing a mask for the remaining of that 10-day time period. If the symptoms develop, then they have to test, stay home. A person that are effective with a prior 90 days, which is those return to work cases, or those returns cases, I'm sorry, they do not need to quarantine unless symptoms develop. So if they're a returned case, so they've already had COVID, and then they're exposed again, they don't need to quarantine, they don't need to test, but they do need to wear a mask. So that's kind of a difference for there. I'll make sure I don't have any. Yes. And then the other thing is always checking with your local county public health department, because each county has those different rules. When I was listening to the webinar the other day, the lady said, I'm going to tell you guys this several times. You have to follow whatever your local public health department says. So, and I find myself saying it repeatedly too. So let's talk about some outbreaks. So there's been some outbreak changes, but I did put this information in here. So I get emails from LA County Public Health every day that tell me the status of COVID in our county. And it tells me the facts and figures, the statistics, people, cases have been positive, people have passed away. It tells me everything that I may or may not want to know about COVID. But one of the things I read on the second was, I kind of thought was important. And that's why I put this in here for you guys, because from LA County Public Health, the week ending April 28th, there was 30 active outbreaks across non-healthcare, non-residential, non-educational work sites. That means restaurants, that means retail, that means us, it's everybody but those things. 30 active outbreaks. And 1 month ago, so the end of March, there was 10 active worksite outbreaks. So there has definitely been an increase on outbreaks over the past month. I don't know why, but when the attorney was going over the information on the webinar on Friday from Fisher Phillips, he said he's received a lot more phone calls from his clients who are now having outbreaks and they forgot what they needed to do. So I kind of wanted to throw this out there for you guys, because I do think outbreaks are a thing that we're not necessarily thinking about, because I feel like people are kind of like, we're on the downhill run of this whole thing, and that's what we're crossing our fingers and hoping for, but it's still there, and it's still there in a very real way for some places. So just kind of be aware of that. And then also I copied and pasted this. This is for LA County specifically. It kind of talks about like reporting requirements and stuff. But basically, if you have 3 or more cases, you have an outbreak, which I'll talk more about that in just a second on the next slide. But you have to call LA County, you have to report it to LA County, and you need to do that within 48 hours of your last knowledge of that 3rd case. And I put the phone number on there so you guys could have it. I don't have the one for Orange County, I'm sorry. Orange County doesn't update me as frequently as LA County, so I just had this the other day, so I thought I'd give it to you. Okay. Any questions? I feel like there's something in the chat, Courtney. You want to tell me if there's something I need to look at?
There is one. It said if someone has symptoms, including a fever, but tested negative, when can they return to work?
I would follow. So if they have a fever, they can't return to work until it's 24 hours with fever-free with no fever reducing medication. So they have to not take Tylenol and be fever-free for 24 hours. So that's your requirement to look at. So it's the fever is going to make the biggest difference because that's the one symptom that can't be present for them to come back. Is there, I think there's, is there another one?
No, you answered it.
Okay. So, okay, so outbreaks are 3 or more cases, COVID positive cases within a 14-day period of time. I'm sure you all know this because we talked about it before. It's pretty, I think you guys are all pretty knowledgeable. So, but what are the new outbreak requirements? So the biggest change in the ETS is that you have to make testing available for everyone in the exposed group, regardless of vaccination status. Previously, you only had to provide it for those people who were unvaccinated. Now you're required to provide it for anybody who was exposed, regardless of their vaccination status. And then employees who had close contacts shall have a negative test within 3 to 5 days, or shall be excluded if they were a COVID positive case and follow the return to work criteria from the date of last close contact. So it basically means that you may have to pay more money because you have to test more people potentially than you used to be able to. The other thing, if you have an outbreak, is you have to evaluate whether you need to implement the social distancing. And it's really confusing because it says like you don't have to social distance, but if you have an outbreak, you have to think about whether or not you need to social distance and whether or not it's practical or logical to, and I shouldn't say logical, feasible is the word I'm looking for. It's a little confusing though, because it tells you you don't have to worry about social distancing when someone comes back after they've tested positive and they're free and clear, but you do have to consider if you have to do it if you have an outbreak to figure out whether or not that's going to make a difference for other people catching COVID. And I can't answer that whether it will or not, but that's just what they said is you have to look at. So, and with that social distancing, the one thing that was changed is, so if you can't do 6 feet, how much can you do? Like you can't be 6 feet apart from someone trying to shoot x-rays on a dog, right? Or like drawing blood and stuff like, I know that. So can you have people in different departments separated more if someone's tested positive and there's an exposure in your workplace? Maybe. I would still consider doing that. Have your front stay in the front, have your treatment team stay in treatment, you know, whatever you can do to separate that and have that written down. We're going to talk more about the COVID written protocol, but that would be a good thing to do is just have an idea of what you can do if you have an outbreak or even 2 cases of positive employees, even if it's not an outbreak that was because of work, but you do have some cases. I would still kind of look at what you can do to help with that because I don't want to say it'll make you look better, but it will be better for your team if you can help them through that stuff, especially if we're seeing more outbreaks than before. But the one thing that has been removed, you do not have to implement a partition. So, you know, we all got those plexiglass things to divide spaces and places and people can sit by each other. That has been removed from the language. So while it still mentions you have to consider social distancing or keeping people separated, you do not have to put a plastic partition in between them. I don't know why they took that away, but that was one of the things that they took away. Okay, so a change for major outbreak. So major outbreak is when you have 20 or more employees within 30 days. So it's not 14, that's a longer time. So you got to pay attention to that. So you might make sure that you're tracking this too. When you have a COVID positive case, you want to make sure that you're writing it down. You write down the date, you write down everything, and all your employees should be listed or all the ones that are positive. So that way you know the dates on that because you're going to have to track whether potentially you may have more within that period of time. It's going to be really important. And when you have any outbreak, you're going to be working with public health. They're going to give you some specific things. They may tell you something different than what I just did, and you're going to listen to them, not me. So if you're working with an outbreak, either regular outbreak or a major outbreak, you're going to have to follow the guidelines that your public health department has you follow. So just kind of be aware of that. But there was some verbiage changes to the testing. So what it said was if you had a major outbreak, and I'll kind of start here where it says there's one notable change. Under the current ETS, it said that the employer must make COVID-19 testing available to all employees in the exposed group at least twice a week. But it was kind of confusing because it didn't help people know, Well, it just said that made available. Does that mean they have to test, or is it optional or whatever? So they did kind of clean up the language on this a little bit, and it says they are required to do so in such situations. So if you have a major outbreak, you're required to test twice a week. And again, if you have a major outbreak, you're working with public health and they may tell you to do it more frequently or whatever. So you're still going to follow their guidance, but that was something that they cleaned up in the language a little bit to return to work. Okay, sorry, I have to have the little like camera screen on there and it keeps showing me it, but I can't see where I'm writing. So I keep having to move it around. So I'm sorry if I pause for a second. Okay. So major outbreaks, again, 20 or more people within 30 days. So the new major outbreak requirements, COVID testing needs to be available to all employees in the exposed group. As I mentioned before, doesn't matter about vaccine status. Employees in the exposed group shall be tested or excluded. So that's the other option. If they don't want to be tested, then they're just excluded for that 10 days or whatever, and following the quarantine protocol and isolation protocol listed by the CDPH. So, and then they're going to follow the return to work criteria starting from the date the outbreak began. And again, you're working with your public health department on that for sure. And you are required to do face coverings. And that's why when I was talking earlier, like just because the state said it's not required for you to go into a store and you're not required to make your employees wear it in most situations like ours, they are required in an outbreak situation. So you're going to want to make sure that they're wearing their masks in that situation. That I don't know if you're required to have your clients wear the mask. I would assume that since this is based for employees, that you're not, but I actually don't know the answer to that question. So if someone was thinking it like I was, I don't know, but my guess is probably not. But that would be something that I might see if I can figure out the answer to that since I don't know. You do need to evaluate if social distancing is needed, as I already mentioned. And then the thing you need to look at too is you do need to update your COVID protocols. Is there something you need to change? If you have an outbreak, is there something that you should do differently to make it so that it's safer? And then again, we mentioned already, it removes the cleanable solid partition requirement. Okay. So here, again, it's just a definition thing. Testing after exposure has changed. The new language simply replaces the exception of the 90 days with a testing within the 90 days to say return case. So I don't know why. I just literally copied and pasted and put everything in there, but this is kind of a redundant slide. Okay, so those are the big major changes, which really weren't that big. It was just sort of changing that you didn't have to wear masks, but you still should keep the mask because you have to wear the masks in an outbreak, changing that you have to do testing for all of your employees in the event of an outbreak, that getting rid of vaccination status, although you probably should still track it just in case. Like, I feel like all these things you should do, but maybe do, like, I don't know, maybe it's just me. So, but what else stayed the same? Pretty much everything else. So the key original ETS positions, or I'm sorry, provisions that remain in effect, you have to establish and implement a written COVID prevention protocol or plan, I'm sorry. If you have not put together a written plan for COVID, you are required to do so on November 30th of 2020. So you're behind the times because it was required like a year and a half ago, but you want to get that in writing. And Cal OSHA does have a model template that you can use on their website. If you want to wait a minute, see if they update it again, you can. But if you don't have anything, I would absolutely get something in writing that says what you're going to do in the event of an outbreak, what you're going to do to protect your team. You know, you need to have something in writing because it has been required and that did not change. You were still required to have that. You're also required to train your team. And the specifics is we all know how COVID is spread. I would assume that by 2 years later, we would know how you get COVID. But guess what? You're still required to put in writing for the team to let them know how it's spread, what your infection prevention techniques are and what they can do, you know, washing your hands for 20 seconds or whatever. We've all heard those commercials. You still need to put that in writing. And then any information on COVID related benefits that affected employees may be entitled to under federal, state, and local laws. And we're going to talk about those in just a moment. There are all those things that you're required to, information you're required to provide your team so that they know what they're eligible for in the event that they're exposed to or catch COVID. And the thing too, as I mentioned, if someone's exposed to COVID, they don't have to quarantine. But if you don't have something in writing telling your team members that, they're going to base it on what they knew from before, you know? So you really do want to put this stuff in writing and say, okay, if you test positive, this is what you do. If you're exposed, this is what you do. and put that in writing for you so that you have a little flow chart or something that you can walk your team members through in the event of exposure. If you have a bigger practice and you have supervisors, I know they're going to get the first text message that says, oh my gosh, I just found this out. They need to know what to do too. So that is where putting the written protocol, it's not just to be a pain, it's really so that you know what to tell your employees in the event. And I shouldn't, when they're exposed to COVID or when they catch COVID, because it's not like they're not going to, it's going to affect you at some point if it hasn't already. If it hasn't affected your team at all this whole 2 years, you get a sticker, but seriously, but most likely it's going to. So I really think you need to put that stuff in writing to help your team out. And then the other thing is notification requirements to employees. You are required to notify your employees within 24 hours if you have a COVID positive employee in the workplace. So that's where you need to have that written plan that tells your employees that if they're exposed to COVID, or if they test, and I should say not or, and they test positive, or I guess or is the right word, I'm sorry. Yes, or they test positive for COVID, they need to tell you ASAP so that you can let anybody who may have worked with them know that they've been exposed to someone with COVID. That is still a notification requirement. That's still a rule that didn't change. So hopefully you've all been doing that over the past years. Also, you need to do that in writing. So you can't just verbally tell them. You can text it. Texting is okay, as long as you can somehow print that or save that or something. But you do need to notify them in writing within 24 hours. And you also need to notify your workers' comp company. And this was something that the attorney from Fisher Phillips reiterated again. And so that's why I put this here, because you are required to tell workers' comp when you have a COVID positive case, regardless of an outbreak status. It doesn't matter. You do have to report it to them. So if you haven't been reporting it, you need to call your workers' comp company and talk to them about it, because you were required to report it from the beginning. Because I remember like the first webinars I was attending, workers' comp knew nothing about why people were calling and reporting to them, but we were told to, because that's what the COVID rules said. So hopefully by now they know how to handle that, but you are required to do that regardless of outbreak status. So the last thing that I'm going to mention that stayed the same is the exclusion pay. And this is the one that everybody hates. So let's go ahead and talk about that next. All right, so exclusion pay is here to stay, or at least until the end of the year. So at least until the ETS ends in December 31st of 2022. And for those of you who missed the beginning of the presentation, the new ETS revisions take effect on Friday, May 6th. And I will be sending out the slides and the recording for everyone to see, so you can watch whatever you missed and you'll have a copy of it. Okay, so back to exclusion pay. And I don't see any other chat questions since my chat box has popped up. So looks like we're still good. Okay, so at least until the end of the year. And exclusion pay is basically if an employee who was excluded from work because of a workplace COVID exposure, they're eligible for exclusion pay. If they are not assigned to telework, or they're not receiving any disability payments or workers' comp payments during that time, during the exclusion period. So this was a really hot button the last time I did this talk, because so many people had no idea about the exclusion pay, and I'm not sure why, but it just sort of got missed. And so it's kind of probably because we had the leaves and sick leaves and stuff. I don't think we're thinking about it, but so I'm going to kind of reiterate this. So what is the requirement for exclusion pay? So I'm just going to read it, even because there's a lot of writing on there. I'm just going to go ahead and read out to you guys. So can employers require employees who are excluded during the workplace to take paid sick leave under the ETS? So basically, I'll back up for a second. So exclusion pay is that you have to pay your employee for the time they were off work because of a COVID exposure from work. And now you know that they don't have to stay home just because of exposure, but if they have symptoms or they tested positive, that's when they're going to be excluded from work, right? Because they can't come to work if they're positive, if they're currently symptoms and just tested positive for COVID. They have that like 5 days or 10 days or whatever that they have to wait. So can you have them take paid sick leave instead of paying them exclusion pay? And that's a big deal. I'm going to say the answer is no, except there is an exception that if you as an employer pay them a sick paid leave policy that's separate and in addition to the California's paid sick leave policy. So I'm just going to say the California paid sick leave policy is that 3 days or 24 hours of paid leave, or when you do it per hour, and they can get up to 48 hours of pay or whatever, or 72, I'm sorry. So if you give them a separate sick leave in addition to what California requires, you can have them take that leave. I don't know a single hospital that gives extra outside of the California leave requirements of sick time specifically. So I'm going to say more of you probably aren't going to be in that realm, but you cannot require them to use their California paid sick leave if they were exposed and contracted COVID from work. You are required to pay them exclusion pay. The other thing you cannot do, and for some of you, this isn't going to apply anyway, because they did do the supplemental paid sick leave, but that only affects employers who have more than 26 employees. So if you have more than 26 employees, and we're going to talk about the supplemental paid sick leave in just a little bit, but if you have more than 26 employees, your employees are eligible for whole other leave. And you cannot have them take that other leave in lieu of giving them exclusion pay if they're entitled to exclusion pay. Okay, so I just want to make that really clear to everybody, because it is important that you don't say, oh, you can use your sick time, so I don't have to do exclusion pay. No, if they were exposed at work and they contracted COVID at work, you have to give them exclusion pay. Okay, so more exclusion pay. How long does an employee with COVID exposure or who tests positive for COVID? Now, the exposure part is not applicable, because now we know that if they're just because they're exposed doesn't mean they don't have to work. It's going to be someone who's testing positive and is not at work. How long are they entitled to receive pay while excluded from the workplace? So I'll read it again to you. An employee would typically receive pay for the period the employee is excluded, which could be 10 or more days. If an employee is out of work for more than the standard exclusion period based on a single exposure or positive test, but still does not meet the regulation requirements to return to work, the employee may be entitled to other benefits, such as temporary disability, supplemental paid sick leave, or regular disability. That's in addition to, not in lieu of. So, and with the supplemental paid sick leave too, that gets a little bit tricky. I would probably not do that if you can, because not all of us are going to be required to even use that leave anyway, because we don't have that many people. But the one thing that if they get COVID today because they're exposed to work, right? So I get COVID, and then 5 months from now, I get COVID again because I was exposed again at work. You potentially have to pay them again. So it's not just because you did it once, you don't have to do it again. So I would say you're going to want to read the rules really heavily at that time to determine, what your factors are, because maybe the state would say, okay, you can do disability, but I'm going to say probably not. Okay, so this is on OSHA's website, so all of the employees would go there and read for fun. It says, what rights do employees have if their employee retaliates? Basically, it tells them what to do if you retaliate against them for asking to use exclusion pay. Just don't retaliate against them, and you don't have to worry about this. Do you have to maintain employees' earnings and benefits if the employee is unable to work for the reasons other than a COVID exposure at work? So they made it very clear that you're not required to maintain certain things if they're staying home because of nothing to do with COVID or because they were exposed somewhere else. Now, most of us are probably not going to get rid of someone's health insurance because they missed a week of work. Probably not going to happen. But per this ruling, you don't have to maintain their benefits. But I would say not likely that you're going to stop that. So one thing that you do want to be aware of is that if they are home because they got COVID from the barbecue they went to last week, they're going to be eligible for benefits that you give them, vacation, sick time, whatever. If they have to stay out longer, they may be eligible for disability. They may be eligible for CFR leave, even though that's unpaid. So there are other leaves that they may be eligible for. So you're going to be responsible for working with them to know what they're eligible for too. You can't put that on the employee, because guess what? It's always the employer's responsibility to make sure that you know what leaves your employees are eligible for. It sounds like a pain, but it is the employer's responsibility, not the employee's responsibility, to know what they may be eligible for, especially when it's something like this. Okay, so this is the good one that kind of answers. The ETS says that the employer is not required, back up, to pay exclusion pay if the employer can demonstrate that the employee's close contact, or I should say, or exposure, they didn't catch it from work. So this one, you're not required to pay your employee exclusion pay if they caught COVID from the barbecue they went to last week, but you are required to prove that they didn't get it at work. Unfortunately, the burden of proof is always on the employer, not the employee. So you will have to prove that they didn't catch it from work. So you're gonna have to do an investigation. And I'll know a lot of times people were like, I don't know what to do. I don't know what to say. So the first thing you do is just talk to the client or talk to the employee, find out, How did you catch COVID? I mean, don't necessarily be obvious with it, but ask them those questions. You need to do the investigation to determine where, to the best of your ability, they got exposed to COVID. Because if you have no other employees that have COVID, maybe they didn't get it from work. But what if you had a client that was in a room for a while and maybe that client had COVID? And you might not necessarily know that because the client might not tell you. So you really do have to do a thorough investigation to determine whether someone is eligible for exclusion pay based on the fact, did they contract COVID from being at work, or did they get it from somewhere else? And I know that's a hard thing to do, but you are going to be required to do that for on the employer's end, not the employee's end. And that's pretty much everything for California. The employer has the burden of proof all the time. So, okay, so how is the exclusion pay calculated? And again, this is copied and pasted from the DIR, California's Department of Industrial Relations website. And it says, how is it calculated? The rate of pay for exclusion pay is at the employee's regular rates of pay for the pay period in which the employee is excluded. Now, I'm going to stop right here because the word regular rate of pay, a lot of you are going to think that's the hourly rate. It's not. Regular rate of pay is the weighted rate of pay based on whether they have bonuses or shift differentials, or if they get like, I know we don't use piecework, but piecemeal, like if they get paid per piece and stuff, we don't really do that here. But if they get like a commission check or something for doing something, anything that potentially could make their hourly rate higher. So most places that I've seen do like a shift differential, if they work like a swing or a graveyard or something, they'll get an extra $1. So you actually have to take the average, and that's how you determine the regular rate of pay. And that's what you'll use. And these employees are entitled to the exclusion pay depending on the length required for exclusion period. Maybe it's only 5 days. You have to know what their schedule was going to be. Were they going to be scheduled to work all 5 days if they did not contract COVID and have to stay home from their workplace exposure? So you have to know how many days they would have worked, what was their schedule, and you have to average out their regular rate of pay to know how much to pay them. And they must be paid no later than the regular payday for the pay period in which the employee is excluded. So there's not like catch up time for you. You really have to do it like ASAP. So if you have someone excluded, you got to sit down and calculate that out right away. Can Cal OSHA enforce exclusion pay provision? Yes. And they can give you a violation. Pretty much anything that you don't follow their rules, you can get a violation for. So just be aware. Okay. This last part of the exclusion pay was, what if an employer does not exclude the employee from the workplace when they were exposed to COVID? Now, because the COVID exposure rule has changed, that doesn't matter anymore. Well, sorry, that doesn't matter to require them to be excluded. It matters that they need to get tested if they were exposed to someone with COVID, but they don't have to be excluded specifically just because of exposure. But if they test positive for COVID, say you don't exclude them, you know full well that they're still positive for COVID because they just tested this morning or yesterday or whatever. If you don't exclude them, then 100% you can get in trouble for that. So, and there's ways that it's all listed on the website that, people can report you if you're not, playing safe and following the rules with people who currently have COVID. Not the ones that had COVID in the past, now they're okay. The ones that currently have it and you're not excluding them. I don't know any hospital that wants people to come in with COVID, so I don't think that's a thing that we have to worry about, but it's my legal disclaimer to you guys. So you need to make sure you're not allowing them to come in if they might be sick. And I know sometimes employees will say, no, I feel fine, but they have the symptoms of COVID. So you got to kind of sit down with them and talk to them about that too. Okay. Can they qualify for workers' comp if they were exposed to COVID in the workplace? I copied and pasted this, and it's a maybe. I would talk to your workers' comp company before assuming one thing or the other and just say, hey, this is a situation. Is my employee eligible for workers' comp? And then they're going to tell you yes or no. Okay. So any questions on exclusion pay? I know I kind of went through that fast, but we're good. Okay. So this last section is on the supplemental paid sick leave. This only affects employers who have 26 or more employees. So if you do not have 26 or more, good news, you're not required to follow this or do anything with this. And it's kind of very similar to the original paid leaves that the FFCRA did, and then the second one that they did in the beginning of last year, and then the one they did for California from April to September. It's pretty much very similar to that, but it only is for people who have 26 or more. So one of the things that is important for you to be aware of it's going to affect your employees who can't telework. You know, obviously we know that most of our employees don't telework, so we're pretty much stuck with it. But this is in addition to any other leave they've received as far as a supplemental paid sick leave. So if they got the SPSL last year because they were sick in July and they got 40 hours or 80 hours or whatever they got, that basically reset this year. So they're allowed to get a whole second group of leave. So if they get sick from COVID, or if they have a family member, and I'll go through the reasons in just a moment, but if they're eligible to receive the SPSL now, then it doesn't matter whether they received it in the past. They're allowed to receive it now, and that's what they're eligible for. The other thing that's really important for you to be aware of is that they decided and publicly told everybody that this new, or not new, but this updated SPSL was effective January 1, but they didn't tell us until February 19th. So they gave all employers 10 days to kind of like a grace period where you could go back and look to see if one of your employees who was out sick with COVID was eligible for COVID leave at that time. And then you had to fix it and pay them then. If you did not, you have 26 or more employees, and you did not go through your payroll January and the beginning of February to determine whether or not any of your employees needed to be paid the SPSL, you're way over the 10-day time frame that you were given. So I would say you need to do it right now. If you may have an employee that was eligible for sick leave and used other time, vacation time or sick time, or didn't get paid at all, or whatever happened, you need to make sure that you're reviewing that. Now, if you paid them your own version, that's great. But because, again, as I mentioned, the leaves are going to be the regular rate of pay, you're going to need to look at what amount they would have been eligible for. So you're potentially still need to look at what the leave requirement would have been if we'd had it at that time. So I know it's kind of complicated. It's been back to January, but pretty much that's what it is. Okay, so what are the circumstances that allowed a covered employer to take the 2022 COVID supplemental paid sick leave? Basically, it provides two separate banks of leave. Each leave has 40 hours. You may have some employees that are eligible for 80 hours, depending on the situation. So the first bank of COVID paid leave up to the 40 hours, if they're not able to work or telework, these are the original reasons back in the day when we first had the FFCRA leave. So if they are sick, they're told to quarantine either because they have COVID or they were advised by their doctor that they have to quarantine due to COVID or experiencing symptoms of COVID or whatever, and they're seeking a medical diagnosis. That's reason one. Reason two, they're caring for a family member who is either subject to a quarantine or isolation. And one thing I'll say, the definition of quarantine means that you were exposed and you might be sick, but you don't know yet, but you're going to stay quarantined because it's safer. Isolation period, meaning you have to quarantine because you have COVID. So for a medical professional, you might be told to do both or one or the other. We used to do a lot more quarantining before, but now it's not required from exposure only, unless you have a medical professional telling you that you need to. So back to this, sorry. So covered employee is cared for a family member who is either subject to one of those two, quarantine or isolation period relating to COVID, or has been advised by the healthcare provider to do to quarantine due to COVID-19, or the employee who's caring for a child whose school or daycare is closed or unavailable due to COVID-19 on the premise. And I'll go over that little piece in just a moment to give you a little bit more of a definition. The other thing is that if it's vaccine related, so if they go in and get a vaccine or get not a vaccine, not like they get tetanus, that doesn't count. They get a COVID vaccine, whichever one they get, and they have a reaction to it and they're not able to work. Guess what? If you have 26 or more employees, they're eligible for SPSL. So, and for however many days they're affected by the vaccine, up to the 40 hours. Okay. And the second bank of the COVID supplemental paid leave for up to 40 hours is available only if an employee or family member for whom they are providing care tests positive for COVID. So there's some employees that can get it twice, but not all. If I don't have a family member that I need to take care of for COVID, then I'm only, if I get sick with COVID, I'm only going to be out once for 40 hours. I don't have the ability to be eligible for another 40 hours. Some people will be eligible and some people will not. So those are the only two reasons that you can get that second 40 hours is if you had yourself and then you have a family member. It would be nice if you had to do family member if you're all sick at the same time, but and one thing that I'm 99.9% sure, there is no tax credit for this. So this is pretty much out of your own pocket as the employer. If someone knows there is now because they've seen something, let me know, because I did not see any changes to that. Okay, I'm going to go over this really quick and then I'll answer some questions I see popped up. So what does it mean for a child's school or place of care to be closed or unavailable due to COVID? This means that the child's classroom, school, place of care was closed after January of this year. So if it was closed in December, that doesn't count. If it was closed because their plumbing flooded the place, that doesn't count either. It has to be COVID related and it has to have happened after January 1 of this year. And they have to say we're closing down because we have, 5 students exposed to COVID and everybody's sick or something like that. That is the only reason why they're eligible. And then the other thing on that supplemental paid sick leave is how are family member and child defined to the supplemental paid sick leave. So they have pretty clear definitions. I'm just going to read that to you. It's going to be the same as last year's supplemental paid sick leave. A family member includes a child, parent, spouse, registered domestic partner, grandparent, grandchild, or sibling. A child can include a biological, adopted, foster child, stepchild, legal ward, or child with whom the employee stands in loco parentis of. A parent includes a biological, adoptive, or foster parent, step parent, legal guardian of the employee or the employee's spouse or registered domestic partner or person who stood in loco parentis when the employee was a minor child. So those are the definitions that they've given. Okay. One more slide and then I'll pause for the questions. Okay, is a covered employee eligible for the 2022 SPSL if someone with whom the covered employee lives is exposed or experiences symptoms or is diagnosed with COVID-19? So the covered employee is eligible for COVID-19 SPSL if the employee is caring for a family member whom a medical professional has recommended to stay home or caring for a family member who's subject to the COVID-related quarantine or isolation. The one thing I'll tell you is just because your roommate has COVID, but you're not sick and you tested negative, you're not eligible to stay home unless you're legally taking care of them. And that again is going to be in that, what's the relationship with you? If it's your best friend, unfortunately, that's not on the list of people that are covered by the SPSL. So you're not eligible for it based on that. I think there's a lot of confusion with that. It used to be you had to stay home if your roommate had COVID because you were exposed to them. That's not required anymore. So you're not going to be eligible for SPSL just because your roommate's sick. So, okay, Courtney, what are the questions?
No questions. A couple people just had to leave and said thank you for them.
Okay, perfect. So I think this might be last slide. This is so awkward. My video things keep moving. Okay, so does being subject to a general stay-at-home order? I'm praying that there is no general stay-at-home orders like we had in the past. But as of right now, if there is a general stay-at-home order given to everybody and you can't work because of that, you're not eligible for SPSL based on the current rules. So hopefully that doesn't happen. But if it did, with the current system, you're not eligible for SPSL. Okay. The one warning I want to give everybody, and I already kind of mentioned it regarding SPSL. You cannot force anyone to use it if you're required to give them exclusion pay. It only affects people with 26 or more employees. There is no benefit to someone under 26 employees because you're not getting a payroll tax credit, pretty much paying out of pocket. Now, if you as a hospital have enough funds to cover employees, I know a hospital that paid, they had a lot of people out sick in January, different periods of time between the two hospitals, and she paid everybody's like payroll. And she wasn't required to at that time because the SPSL did not take effect till the next month. Now she would have had to go back and she had to compare, I'm sure, when after it came out with the rule again, but she did that because she had the funds and she could do it and help them out. So you can do it. You can pay your employees, but you're not required to unless you have 26 or more. You do have to notify your employees about the supplemental paid sick leave though. I think you guys, if you remember when we had the FSCRA leave, they had that nice little like poster that you had to put up in your break room or wherever with all your poster stuff that told people about the leave. You're still required to notify your team now if you have 26 or more. And if you don't, you could be some fines. There could be some fines for you because Foster Farms was fined $3.8 million because they didn't notify their employees that the SPSL leave was reenacted or revisited or whatever. So it's a big deal. If you haven't done anything with it, you need to get on that as soon as possible because there could be consequences to you. Okay, so that's pretty much most of the presentation. This last part is just your communication requirements that didn't change from, this is from the original ETS. At the end of the presentation, I'll have all the links of everything that I utilize. They're pretty much very similar to the links I sent out to the presentation in January, but I'll send those again so you can easily access things. I don't have all the public health departments. I have all the Southern California public health departments, but if you live in a different area of California, I put the link to the CDPH that gives you all the public health departments, but I didn't go through and look up all those individual links. So, okay. So basically, what are you required to communicate to your team? What, you have to identify and correct COVID-19 hazards. We already talked about that. You're required to provide face coverings, the N95 when you're required to do it. When you have an outbreak or when an employee asks you, you are required to give those to them. You're supposed to still be reviewing your controls as part of your safety protocol, but you don't have to clean all the time, like I mentioned earlier. You do have to have procedures to investigate and respond to COVID-19 cases in the workplace. And that one is still big because you have to track if you're having an outbreak. And you don't necessarily get to decide if you're having an outbreak, but if you have 3 cases, you need to notify public health. So you need to investigate all those cases when you call them so you have information that they're going to ask you. I wouldn't just call them blindly, but you can only, I think you have 40, I know it's 48 hours for LA County. I don't know if that's every other county, potentially. So I would check with your county and find out how much time you have, but definitely just be aware that you need to have a system for reporting that. You need to make sure everybody's trained and knows what to do, especially all your supervisor levels. They know what to do if someone tests positive. The system, if someone has their roommate test positive and now they know they're exposed, they have to test within 3 to 5 days. They need to tell you that so that you're aware of what they're doing too. And it's having that open communication with your team. You need to make testing available at no cost to the employees who had close contact at the workplace. So if you have an extra stash and you want to give it to your employees to test themselves if they're like their roommate has it or whatever, that's totally up to you. You can, but you don't have to unless it's workplace exposure. So if you don't have any COVID tests at your hospital right now to test your employees, I would. It's worth getting a couple. They have like a 6-month shelf life. So I guarantee you at least one person is going to need to use it within 6 months. And then you're also going to communicate to them when they should be excluded. You need to tell your team when they might have to quarantine, when they should isolate based on the CDPH's guidelines. Okay, so this is just some links for me. The Service Pro company that was cleaning hospitals. Again, this is not required in the same manner it was, but if you have an outbreak, not necessarily a bad idea to have someone come in and clean just so you know you've done it. If you can also get that Euceris spray that you can do it yourself. I've actually done it a few times for one of my practices, and it's kind of fun. You just go around and spray the fogger stuff on the surfaces and stuff like that. But again, you could do this regularly if it makes you feel more comfortable, but you're not required to, except when you have an outbreak status. Here's your Cal OSHA and your CDPH resources. And then you've got your LA County, Orange County, Long Beach, Pasadena, San Bernardino, Riverside, San Diego, and Ventura. It's all the Southern California links. And then the last one on the bottom is all the public health departments in California. I did put some links to the Department of Fair Employment and Housing. I also put a link to the supplemental paid sick leave. And then there's other leaves that EEOC has some information for you guys. The last thing I want to show you, I highly recommend that you go onto Fisher Phillips website and sign up for their alerts. I get emails from LA County Public Health and from Fisher Phillips. And Fisher Phillips, being a law firm, they send out alerts about a lot of stuff. They do like Wage and Hour Wednesdays, where they do webinars and they talk about stuff. It's not all about COVID, but it's all about labor law and stuff that affects you. Sometimes it doesn't affect me because they might talk about like stuff that affects only people in unions or, different industries and stuff. But a lot of times it does affect me. And I've learned a lot from this company. So I highly recommend that you go on there and get their alerts too, so that you get in the loop of things and kind of are aware they're a good company. Okay, if there's any other questions, please feel free. You can unmute yourself and ask, or you can throw it in the chat. If there are any questions in the chat I need to be aware of, let me know, Courtney.
Yep, we do have one. Natalie wants to confirm, it's jumping, hold on, that for the SPSL is for 25 or more employees, correct?
More than 25 employees, so technically 26. So if you have 25 employees, you're okay. But if you have 26, you're required.
And the rest are just saying thank you.
Excellent. So if you guys want to follow my social media, I have Instagram and Facebook and my YouTube channel, which I'll send you the links to that. So I appreciate you guys joining me today. It was a lot less painful than the last one that I did. So there wasn't that many big changes. It was more scary than I thought. It was more scary when I thought about it than it actually was when I got all the information. I was like, oh, this is great. So thank you guys for coming today. I appreciate your time and appreciate all of your nice little, I see the comments popping up, which I think is everybody saying goodbye. So I'll click on it so I can see the chat. All right, awesome. Thank you guys. I appreciate you guys attending and being part of this today. Appreciate it. Hi, Tracy. I see you on the screen now. Hi, Lauren. See you too. All right, so I'm going to go ahead and stop my camera. All right, I'm going to go ahead and end the meeting.